Hello, everybody. This is Dr. Hamid Elamir. I am the host of podcast with Dr. E. At this podcast, I sit with the world's experts in health, education, and community development to ask them about their experiences and talk about the current health challenges so that they can share their expertise, knowledge, and insight with the rest of the world, especially with the developing countries, so that we can learn from experts across the globe. Today, on the show, I have Dr. Titus Chiu, and he is a functional neurologist. Welcome to the show, Dr. Chiu.
Yeah, thanks so much, Dr. Himi. I appreciate the invitation to chat with you.
It's a pleasure. Dr. Titus Chiu is a best-selling author and functional neurologist specializing in post-concussion syndrome. And he has spoken at the 2017 IFM, which is the Institute of Functional Medicine Annual Conference. He has appeared on numerous documentaries, such as Dr. Mark Hyman's Broken Brain, episode 1 and 2. And he loves teaching about the brain. And I am sure that this is going to be a very interesting show today. And I am very interested in learning more about the brain, how the brain works. In this conversation, I am trying to bring up the questions that came to my mind. And of course, I'm sure that the audience are trying to find the answer to. The very first question is, what is the motivation behind the BrainSave, which is your business, also your expertise? And in other words, why do you do what you do?
So over 20 years ago, I was in a terrible car accident that nearly took my life. I was on my way to work. I was on a scooter and I got hit by a car and I ended up with a dislocated shoulder, broken ribs, and I actually had suffered a concussion. But at that time, I didn't realize I had a concussion. And so I had all these health issues, like especially the chronic pain. And I tried within what I knew to be like conventional medicine, I tried within that to get answers. And everything I tried didn't give me long-term relief. And so I had to go outside the box. I went searching outside the box. I decided to go back to school and I did a postdoc in clinical neurology, a master's in nutrition. I got a degree in chiropractic, certified in acupuncture, everything I could get my hands on, not only obviously help my situation, but then to bring the latest information and treatments and tools to my patients. And so
Right.
that's what led me here. And I mentioned to you before the call, along the way, I discovered a deep passion for teaching. And that's what I love doing, is not only working with patients, but actually teaching people how to fix their own brains after concussion.
That's very interesting. And it's very an inspiring story. That's how you turn that challenge into an opportunity and not only saved your own life, but also, helping others to overcome this challenge. And it's not easy, when it comes to concussions and contusion. So when we talk about concussion, it reminds me of my rotations in neurosurgery or during my medical school and the definitions there, concussion and contusion and injuries and all that. So what's your definition of concussion as a neurologist and functional neurologist?
Sure. So concussion it's a type of traumatic brain injury, right? It's or what we call TBI.
Mhm.
And that's when you have either a bump or you have like a physical trauma to the head. But what I've discovered in my research and my whole like journey healing my brain is
Mhm.
that you don't even need a physical trauma
Right.
to suffer from a concussion. I've had patients who've like fell off a bicycle and they just landed maybe on their body or landed on their arm, and
Mhm.
that triggered a whole bunch of symptoms because of the impact. And
Mhm.
so the thing is, after, whether it's a physical trauma or a blow to the head, or even a heavy, strong jostling, it
Mhm.
triggers a chemical trauma that we call immunoexcitotoxicity, where you have inflammatory cascade.
Mhm.
There's a special type of cell in our nervous system, an immune cell we call microglia. And
Mhm.
after that initial physical trauma, you can then have a chemical reaction leading to inflammation, and then the release of certain chemicals that normally should be packaged within our brain cells, they become released, leading to what we call excitotoxicity. When you combine the two, the
Mhm.
inflammation plus the excitotoxicity of the toxins,
Right.
That's what can not only create the symptoms of concussion, but I think it's post-concussion syndrome. I
Mhm.
think that's a silent epidemic because, many people I've worked with, when you talk about doing the neurosurgery rotations, it's like all these people have these acute TBIs or traumatic brain injuries, right? But the question is, well, what happens after that? Or I've even had patients who I work with that, yeah, they were in a car accident, maybe just had a whiplash, and then they developed all these symptoms. One of the reasons for that is because of this chemical process that gets triggered that then doesn't shut down. But the great news is once we can identify the root cause for them, there's a lot that we can do to turn it around. I did it for my own brain. I helped thousands of amazing patients and private clients over the years, and I know it's possible for other people out there struggling with post-concussion syndrome.
So what it takes actually, you kind of like mentioned earlier, what did you actually study after you had that injury, and what it really takes to become a functional neurologist? Like how long do you go to school, and what do you study for that?
Yeah, so it took me about 35 years from kindergarten to the
Yep.
postdoc in clinical
Right.
neurology. After, like I said, I didn't find relief within what I knew. I went outside the box and I actually went back to school to get a degree in chiropractic because that was one of the first things that actually helped me, at least with the chronic pain that I was experiencing. And
Mm-hmm.
so I did, that's a 5 academic year program. And
Mm-hmm.
then from there, I developed this love for neurology. Everything I learned about the brain and neurophysiology and neuroanatomy, I just dove deep into that. So I did a postdoc. That was a 3-year postdoc in clinical neurology.
Mm-hmm.
And it's really cool because I was able to combine chiropractic knowledge, which is very much training about biomechanics in terms of muscles and joints. But then with my training in neurology, I really understood the connection between the body and the brain. And so a big part
Right.
of the treatments I do for my patients are we use and harness the power of neuroplasticity, which is this amazing ability of our brains to change and
Right.
heal based on our experiences. And so, I see a lot of, you know, patients or even doctors when they try to approach something like brain health, they do things like diet and supplements, sometimes medications, and those are important. But the brain is unique, and not only does it require nutrients and fuel, it also requires activation. So, by activating very specific neurological pathways using our different senses like sight, sound, smell, taste, and touch, and then the special sense we call proprioception, which is body awareness. So, I use all those different tools to help pretty much rewire and rebuild a person's brain after concussion. And on top of that, like I mentioned, I did a master's in nutrition. So I was also approaching it from that more biochemical perspective of looking at inflammation. One of the most common obstacles to healing I see for people after concussion is that inflammatory process doesn't get shut off, right? And as you
Right.
know, inflammation is crucial for healing, but if you don't turn off those signals,
Mm-hmm.
then it can actually cause collateral damage and prevent someone from healing. So I took a deep dive looking at nutrition and biochemistry, as well as studying functional medicine. So I can approach it from like the biochemical perspective, looking at gut function, looking at hormones, looking at toxins, all those things that impact the structure of the brain. So the approach I take for post-concussion syndrome is very holistic, looking at the actual physical structures and things we can do with the senses to rewire the brain, but at the same time, making sure that the neurochemical milieu that the
Mm-hmm.
brain exists in is optimized for healing.
You mentioned about you went to chiropractic school, which is just a degree of 5 years, and then you did masters. Of course, you did 3 years of postdoctoral. That's that's in itself is a lifelong time. So just a follow-up question: does it require a medical degree in order to be a functional neurologist?
Functional neurology is a really interesting discipline because it's open to all different practitioners, more like a diagnostic approach, right?
Mhm.
So there are chiropractors that are functional neurologists, there are medical doctors, there are
Mhm.
naturopathic doctors and physicians. So it's really open. It's a specialized type of training, like I said, that
Right.
really focuses on advanced neurological rehab
Hmm.
treatment options, especially when it comes to the brain. Like I mentioned earlier, I think medicine is so biased towards just looking at biochemistry, like medication to shift a person's health, what kind of diet or what kind of supplements. But when it comes to the brain, that stuff's really important. But we
Right.
also need to look at what's actually happening in the different structures that we call neural networks within the brain. And that requires a very different and unique approach. Again, using like sight and sound, and vibration and frequencies, but we can do it in such a specific way because after an advanced neurological exam, that a lot of it can be done virtually, these days, especially. I can identify what the weak links are in those pathways.
Hmm.
And each of our different senses travels along a very specific pathway. So, as an example, after a concussion, a lot of patients I work with, they develop either balance issues or headaches or vertigo. A lot of the time that's due to an imbalance in either the cerebellum or the
Right.
vestibular system. But guess what? The cerebellum feeds off of our senses, specifically our body senses. So
Right.
things like, movement exercises, things like balance exercise, even things like yoga can retrain the cerebellum. And then with the vestibular system, which is at a root cause for a lot of things like motion sickness or even anxiety, I see in many situations.
Hmm.
Like when we do what we call vestibular rehab, very specific head movements and eye movements, we can literally rewire those pathways. So yeah, in terms of functionality, and answer your question, it's, you know, any practitioner can study it, but it requires a very different look at
Right.
how to approach it outside of just shifting the
Right.
biochemistry through medications, diet,
Mhm.
and supplements.
Yeah, so the reason I asked is also there's functional medicine, which some of the physicians are taking a certification in functional medicine, so you can know what else is good for your patients. Let me ask you, who are your clients? I would put it clients rather than patients to just get
Sure.
that sickness out of it.
Yeah,
But
exactly.
so, in other words, your clients or your patients, who are they?
I work with a lot of different people. One of the things who I enjoy working with that they really get a lot out of it, the process, is
Right.
high achievers. And I take high achievers from barely surviving back to thriving
Mhm.
after their concussion. And when I say high achievers, it could be business owners like entrepreneurs or executives. I work with a lot of other doctors as
Mhm.
well, health coaches, but even students. I work with a lot of students who are at the top of their game in school, either in college or high school. But
Mhm.
then after a head injury, sometimes even a mild one, they get thrown off their game. So those are the people that I really enjoy working with that get the most out of my programs.
Great answer. So, how would we be able to integrate, as I mentioned earlier, that there's functional medicine that some of the physicians are taking that certification to integrate that into conventional medicine. How
Yeah.
can we integrate functional neurology into conventional medicine or neurosurgery neurology?
I'm so glad you asked that question because, when I think about healthcare, think about serving the population of people that need this, really, it needs to be personalized. So, like we talked about earlier, you're talking about your neurosurgery rotations. Like after I got hit by that car, don't get me wrong, it's like I don't want to do any neuro rehab or take supplements at first. I went to the ER. Those doctors, those heroes, they made sure that my life was not in danger. But what I see is there's this huge gap then. Once people get cleared from the acute TBI or concussion, it's like, what next? I see there's a great way of integrating conventional medicine, especially for people who are in their acute stages of the concussion, and especially if it's really serious. But
Right.
then from there, moving forward, it's like the more chronic and what I specialize in post concussion syndrome. That's where things like functional neurology comes in. It's like rebuilding those areas that have been damaged from the concussion, number one. And then also, yeah, I also integrate functional medicine because, like I said, I look at the biochemical issues, and those are the things that are necessary to create the perfect environment, like chemically, for healing. So, as I really see it, is a multidisciplinary approach needs to be taken based on where a person is at in their journey. And a lot of the people that end up at my office are people who have been struggling for months or years after the original head injury. And
Right.
they've gone to the conventional route. They've really tried those things. And again, thank God for those doctors. Thank God I saw those doctors after my car accident over 20 years ago. But then what's after that? And so that's kind of where I see functional neurology and the functional medicine approach really kind of then taking over from there, making sure that there is some damage to the house in the hurricane or whatever, and making sure that everything's safe and not going to fall over anymore. But then from there, how do we rebuild, right? And that's where functional neurology and functional medicine really shine.
Well, thank you for mentioning that. And I'm actually working right now with all healthcare professionals from different walks of health, from functional medicine to naturopathic to chiropractors and public health, clinical psychology, conventional medicine, physicians, surgeons, to come all around the same table to have an upstream systematic approach to health where we can have a better world. As you just mentioned, go into a doctor's office or a hospital for an acute health issue, you're getting that prescription. So what happens next? That's one point. And then the other important part is also how can we prevent all these from happening in the first place? And that's what I focus right now. And I'm lucky that I have you here on the show, functional neurologist. That's really amazing to just to hear about your expertise and what exactly you are working on. I know we are already to the end of this show. It was really interesting. The time just passed. Please tell us, how can people find you?
You can go to my website to learn more about my root cause concussion care approach. It's
Right.
called BrainSave. So you just go to brainsave.com.
That's brainsave.com. Again, Dr. Titus, thank you so much for your time. It was a pleasure to talk with you today.
Absolutely. Thanks so much for the invitation.
Dear audience, for more shows like this and a holistic approach to health, please stay tuned and listen and follow the podcast with Dr. E. Have a great day.